Excellent, thank you, Gerald. Good morning, everyone. Welcome to the public meeting of the Oversight and Engagement Board for the 27th of August. The time is 10:17. Apologies for the late start. Thank you, everyone, for attending, as always. We come straight on to item number 2, which is minutes of the previous meeting of the 20th of August for the public section. I presume everyone's happy with those. I'll take it as read that we are, and we'll sign them off. Thank you very much, everyone. Item number 11 is the summary of local surveillance data, and I'm going to come over to Lucy Whiteman, the Director of Public Health. Thank you, Lucy.
Good morning, everybody. Thank you, Councillor Morris. So, as normal, we have got our weekly surveillance report. So this surveillance report covers data up to the 16th of August. People will note on the front cover, there's obviously our continued warning about the increase in cases of COVID-19 in Northampton, Corby, Kettering and Wellingborough, asking for those residents to be following those additional local guidance rules. Northampton, obviously, as of last week, was brought up to be an area of intervention, and that's following an outbreak of cases in the Greencore factory in Moulton Park Industrial Estate. The Secretary of State has required those employees and their household contacts to self-isolate for 14 days from last Friday. And we await further information from the Department of Health and Social Care about the legislation around that to formally enforce, which we understand is due tomorrow. So obviously within Northampton Borough, we know that there's been an increase in cases, and the local incidence rate last week hit 125.1 cases per 100,000 people, and that ended up making us the area nationally with the highest incidence. Obviously, we do recognise that that is in a large part driven by the number of cases identified through the Greencore proactive private testing, but all the same, obviously, we must remember that prior to the Greencore outbreak, Northampton was an area of concern. And as I said, we have got a number of other areas where we've seen an increase in cases, and therefore all of the requirements to manage social distancing, to manage hand hygiene, to obviously kind of hold back and try and minimise any contact outside of your direct family, your household, or your social bubble to a minimum, and obviously to continue to work from home wherever that is possible. And that really is just, again, to try and reduce the likelihood of onward transmission. So from a point of view of the national position, Northamptonshire now is also a county that is statistically significantly higher in its rate than the national average, and the borough of Northampton remains also above that national and regional average at 740.4 cases per 100,000. The rate of infection is still very much concentrated on the centre of town, and also from a point of view of Wellingborough, there are also areas, particularly the Victoria ward, that have got a high focus of cases. From all of the information that we've got, obviously, we know that Greencore employees are now required to self-isolate alongside their household contacts. And obviously, we remind people that that is the requirement for anybody who is either got symptoms and they need to get tested, or anybody who's been a confirmed case needs to be self-isolating for 10 days and their household contacts for 14. So all of those requirements remain in place and obviously are not just unique to Greencore. If we look at the data itself, then we've now had a total of just over 4,000 cases at 4,080 cases to date, and 334 were identified in the week up to the 16th of August. Now you'll see from slide 7 that a large proportion of those cases were actually assigned to Pillar 1. So 208 were assigned to Pillar 1, and usually that is testing that's undertaken in clinical settings for patients or for staff. However, the Greencore testing was actually assigned to Pillar 1 because it was undertaken privately, and therefore that's why there's a sort of a discrepancy in the proportion that actually have been tested positive through that pillar. Having said that, there were 126 cases through Pillar 2, some of which were Greencore employees as well, but obviously others were the wider Northamptonshire cases that I've been referring to. And that really obviously demonstrates the fact that we continue to have an increase in our incidents and our case numbers, and have done now for 6 weeks. So we need people to really be adhering to those requirements and guidelines. You'll see from slide 8 that the population pyramid that looks at both gender and age, particularly the right-hand side, which is that sort of wider testing, now very much shows that it's the working age adults that are being affected. And you can see there quite a significant increase in the last couple of weeks in the number of cases in 0 to 19s. And that's particularly pertinent when you consider that schools will be returning in the next week or two. So again, making sure that people remain vigilant to symptoms and have any concerns at all, that they should be self-isolating and getting tested. And obviously we're working with schools to make sure there are appropriate processes and policies in place to support them should they identify cases. As I said, Green Core tests were actually allocated to Pillar 1, so that will play out in some of the working age adult numbers in the Pillar 1 population pyramid increasing. Again, Green Core employees range from being in their 20s to being in their early 70s. So again, you'll see that spread across that Pillar 1 pyramid in this week as well. Slide 9 just gives you a summary there of where we are from a point of view of trends. So we've got an increasing overall trend in incidents in Northamptonshire as a county, and obviously Daventry there and Northampton also are showing increases. Daventry, you can see very small numbers, but obviously we need to make sure that we keep an eye on all of the areas where we've got increasing cases. Slide 10 shows whether our rates in our boroughs and districts are similar to, lower or higher than both the county rate and the England rate. And as I said, for the first time, you can see that Northamptonshire is statistically significantly higher as a county compared to England. And that rate, because it's cumulative, so it includes all of the cases since the beginning of the pandemic, the areas that are most greatly affected locally continue to be Kettering and Northampton. If we look at slide 11, we've obviously got the graph that shows the cumulative number of cases since the beginning of the pandemic for each of our boroughs and districts. And you can see that considerable increase in the week prior to the 16th of August, which is mostly driven by the private testing undertaken by Green Core. As I said, still a handful of cases elsewhere within the county, so we must remain mindful of that. And importantly, the rate of daily lab confirmed cases. So obviously this makes that comparison between areas easier. We've talked about it before on slide 12, really shows that ramp up from the Green Core testing. And you can also see that echoed in the dotted, the sort of dashed grey line, which is Northamptonshire overall. And similarly, an increase in the thick grey line, which is Wellingborough. So you can see the impact there on most of the areas that those employees live. So the cumulative cases by community is mapped on slide 13, again very much focused on our high density, more deprived areas, as has been the trend since the beginning of the outbreak. And slide 14 shows that as a rate, so comparison across different areas. People will be aware that actually Green Core is in the Malton ward, and those tests were allocated against the Green Core factory address. So there is a disproportionate increase in the number of cases being attributed to Malton. We do have all of the information just to provide assurance to people about where all of those residents actually live. But obviously for the purposes of reporting, the cases have been attributed to the Malton ward and to the work address. Again, you can see that effect on slide 15, which is the cases in the last 28 days. And similarly on slide 16, from a point of view of the cumulative case rates. So as I said, just to reassure people, we have got all of the case individual addresses for the residences of Green Core employees, and again have been targeting our interventions to support those areas where they've got those high case rates. Slide 17 provides a summary of our outbreaks, exposures and clusters. So we currently have 17 active outbreaks in Northamptonshire up to the 19th of August. 3 of those still in the workplace, 11 in care homes, and a handful elsewhere. You'll obviously see that the number of confirmed cases from particularly the workplace outbreaks has significantly increased. again in relation to Green Corps, but we continue to monitor and work proactively with Public Health England, who is the first port of call for outbreaks for all of them, even where small numbers are concerned, to make sure that obviously they don't escalate. We're also focusing a lot of our interventions on the areas where we've got high density workers, such as industrial estates, and we've got a number of mobile testing units circulating those areas. So slide 18 just gives a summary of the ongoing public health actions. And obviously these are not just of the public health team at Northamptonshire County Council, but also of all of our licensing and environmental health officers in the boroughs and districts, with support from the police, and obviously a number of other areas, such as all of the people helping the schools to get ready and the ongoing support from those supporting care homes, etc. So this really is a multi-agency workforce when we talk about public health actions. And obviously at the end, we've just got reminders about how people can get information about local testing sites, that obviously if they can book online, please do so, that they can drop in, but they will need to make sure that they follow any drop-in testing with a registration online to make sure it gets processed. And again, any further information that people do want, the Northamptonshire County Council website has a wealth of information, resources, and obviously the overall outbreak plan there, should anybody wish to refer to it.
Thank you very much, Lucy. A very comprehensive run through of that document, as always. I'm looking around the room. There don't appear to be any specific questions on that, in which case let's move straight on to item number 12, which is situation update. And again, we come back to you, Lucy. Thank you.
Thank you, Councillor Morris. So obviously people are aware of the position with Green Corps. There were just under 300 positive cases identified. Those are now self-isolating on the request of the Secretary of State from last Friday for 14 days, along with all of their household contacts. We're providing support to those that have requested it through a proactive registration document for things like support with food, shopping, and medication deliveries, etc. We're also working with Green Corps to support them. They've undergone a deep clean and have been working with Department for Health and Social Care, Public Health England, the environmental health officers and myself to make sure that they're able to reopen and start a small production line with employees that are either new through an agency, have been furloughed for more than 14 days prior to the Secretary of State's announcement, or who have had a previous positive test or been the contact of a previous positive test and so have completed their self-isolation period. So because of Green Corps' thorough cleanliness programme over the weekend, obviously all agencies have been happy to support them reopening on a phased approach, utilising some of those staff as per agreement with Department for Health and Social Care. So they have a small production line back up and running at the moment. Obviously that will be reopening until it's fully reopened in phases as and when staff become available. From a point of view of other areas, Wellingborough, as I said, was impacted by cases from Green Corps. And again, we've been making sure that we've got all of the information to support those. And again, we have got outbreaks, exposures and clusters that we continue to investigate and support with our colleagues from Public Health England to ensure that obviously we're aware as soon as possible of any potential exposure, and then in any linked cases that may be considered clusters or outbreaks. Again, we provide community infection prevention and control support through a small team, but also make sure that risk assessments, etc., and site visits are undertaken by EHOs or my team as required to ensure that we're satisfied that those standards are adequate, but also provide support and advice should any of these settings need it. Overall, we've got really good results with regards to testing. We've got improved numbers. I'm sure we'll be giving you more information about that, but we just need to make sure that although Green Corps has provided some challenges locally, we have been making steady progress across the rest of the county with regard to testing and overall positivity rates, and we need to continue to encourage people to engage with testing, engage with self-isolation, and obviously continue to take the advice of increased social distancing, use of face coverings, etc., so that we can obviously reduce the likelihood of onward transmission.
Thank you, Lucy. Again, very thorough report there. I'm looking around the room. There don't appear to be any questions as yet. Thank you very much, everyone. We were coming on to the testing venue update number 13, but I don't think Sharon is on the call. So what we might do is come back to that, and we'll come to comms and engagement, if that's okay. Claire Hughes is here in Sarah Newell's shoes today. Claire, hi. If you could give us your update. Thank you.
It's been another busy week for the comms cell following the government announcement. Northampton's now an area of intervention. We have drafted and delivered social media, our partners and stakeholders last Friday, and that was attended by local and national media. Lucy Whiteman, Director of Public Health, is continuing to be interviewed twice weekly on BBC Radio Northampton, where she addresses the questions of the day. The ComCell has also been working together with the district and borough colleagues quite intensively to ensure that all activity is delivered across the whole county. We're currently putting together a how-to guide for all the colleagues in areas that have not yet seen a rise in numbers. Hopefully they won't need it, but what we're trying to do is think and plan ahead to prevent any issues in the future. The track and trace posters for all pubs across the county are being distributed this week via the environmental health officers and town centre managers. We've got a digital advert that's now showing on the side of the tallest tower in the grounds of Northampton University, and that's warning students upon their return and the rest of the town in the meantime that they are at risk of COVID-19 and all the accompanying behavioural messages that associate with that to try and to prevent further problems. We're continuing to update our social media graphic twice daily with details of the up-to-date mobile testing units. And we're continuing to publish an annotated weekly surveillance report on our council website with an accompanying press release. As part of the ongoing work with the business community, we've reissued an updated business pack, and that's got a number of additional translated materials for the workforce. And we have commissioned posters for 13 bus shelters in Wellingborough, together with digital messaging across pub screens in Wellingborough and Daventry. And finally, the Don't Be a Numpty campaign has been relaunched with a series of videos on YouTube urging people to be COVID secure and not to be a numpty in various high-risk situations.
Thank you very much, Claire. Lucy, did you want to make a comment? I think David Jones from Health Watch has asked a question. Did you want to respond to that? Or shall I read out the question? It was, can we have a focus on care homes at a future meeting? Because there's concern about continued outbreaks within those homes. Lucy.
So I just wanted to remind people, I'm absolutely happy to do a focus on care homes, more than happy to do so. But obviously what we need to remember is we are proactively swabbing all of our care homes routinely. So that's all staff and all residents on, a sort of a routine dependent on the setting, sort of monthly and sometimes more frequent basis, dependent on the level of risk. So we are finding proactively, this is proactive case finding as opposed to random cases sort of popping up. We're finding asymptomatic residents and staff. So just to assure people there's nothing to be concerned about with regard to our current position for outbreaks in care homes. You've got to remember that the definition of an outbreak is just 2 or more cases linked by time, place or person, and therefore with that routine swabbing you quite often will find that you have 1 or 2 people in any one setting asymptomatically positive at any one time. What that's helping us do obviously is make sure that those people isolate and then make sure that the IPC, so the infection prevention and control advice, is being adhered to within that setting. At the moment, there is no cause for concern, and all of the outbreaks, because of the definition that I'm referring to, are very small numbers of cases involved at any one time in care home settings.
Thank you, Lucy. Comprehensive answer as always. We do have the testing venue update, but Sharon isn't here. Lucy, do you want to cover that while in her absence? Thank you, Lucy.
Yep, happy to. So lots of good news actually with regards to testing. And the one thing I'm sadly not able to do is give you a definitive number of tests for the last few days, because nationally the reporting process has changed, and that's not quite where it needs to be yet. And therefore actually the numbers that are coming through locally that we used to be able to get aren't filtering through at the moment, but we're assured that's going to be addressed. But really good news from a point of view of our regional testing site. So people will remember we've been lobbying for this for a number of months. And we've now got obviously support for that to be built, and we've identified a site. It's currently with the 2 legal teams, but we understand that the project build plan will be ready for the end of next week. So we're looking to have that regional testing site at Kettering Conference Centre car park up and running now within a matter of 2 to 3 weeks. The local testing sites are all going well. We've obviously got the 3 that are already established in Kettering, Corby and Northampton, and Wellingborough is being piloted today in the town centre, and it will be running for a full day. So that's 8 in the morning till 8 o'clock in the evening from tomorrow onwards. So really good news, particularly in that higher incidence area. And we're currently looking at options to have a similar local testing site for sort of the south of the county, covering South Northants and Daventry. So councillors have been very generous in offering to try and help us identify sites to ensure that the south of the county is easily covered. So at the moment, the soft intelligence we've got is that we're still seeing easily over 100 tests being completed in each of those local testing centres. As I said, unfortunately not able to be more specific, but we know that from the 1st to the 20th of August across our mobile testing units and the local testing sites, we've done 16,400 tests, which is brilliant news, absolutely brilliant news. But obviously the swab is only as good as the time it's taken. So anybody who's got any concerns, even if they've been swabbed before, need to go back, and obviously we continue to encourage anybody who has any concerns to access testing. The mobile testing sites, we've currently got one at Grange Park, and that's there until Monday to help facilitate testing in some of those higher risk industrial settings. It then moves to Brackmills for 5 to 7 days. So again, encouraging all of the sort of industrial area workers there to seek testing. We've got one at the Castle Car Park in Wellingborough that stays until tomorrow, where it then moves to Thrapston Swimming Pool Car Park in East Northants. And at the moment, we've got one at Tresham College as well, helping to cover some high incidence area around Eyes Village and Burton Latimer. And again, we're looking for that to move over to Western Favel at some point next week. So we're just working on dates for that. So all very exciting, very, very comprehensive service at the moment. But again, we just need people to be making sure that they're being used to capacity, please.
Thank you, Lucy. Again, a great summary of what's going on locally, and I think we are using our resources very well in that regard. I've got Chris Stamborough wants to ask a question. Chris, hello, Chris. Welcome back.
Thank you very much, Ian. Yeah, just a quick question about people who go to be tested and the numbers. I think the numbers are great, and the numbers being tested each day and each week. Really good stuff, and obviously that's a function of the number of test venues we've got. But does the data we get back distinguish between people who are being tested for the first time and people who have previously been tested and are presenting themselves for a further test?
Thank you, Lucy. Over to you. That's a very good question. Thank you, Chris.
No, it doesn't. And obviously, we're quite happy for people to be retested. As I said, the test is only as good as the moment it's taken. So anybody who, even if it's a matter of days later, develops symptoms and feels they want a further test or feels that they've been exposed or are concerned in any way, again, we encourage retesting. There's absolutely no concern about the number of people who would want to have second, third or fourth tests if they feel that there's been a risk. So they're not linked. But again, as I said, because they're only as good as the moment they're taken, we would encourage people to return if they ever have any concerns.
Thank you, Lucy. Brilliant answer as always. I'm looking around the room to see if there's any other questions. I can't see any. Jonathan, did you want to come in at all on anything?
No, thank you. I think it's, as always, been very, very comprehensive. My signal dropped for a moment. I think, did we cover a little on, there was the issue in the air about the return to Green Corps staff, which was basically fundamentally to facilitate the very important deep clean. It may just be worth referencing that, which Lucy kindly has given us some information on earlier, but we may not mention publicly. Apart from that, Ian, I think it's been very informative as always. Thank you.
Thank you, Jonathan. Lucy, did you want to reiterate the points around Greencore and the team that have gone in to do the deep clean, if that's okay? Thank you.
Yeah, absolutely. So Greencore have been working really closely with us, as people will be aware, throughout this situation. Department for Health and Social Care and Public Health England, myself and Greencore obviously discussed the request the Secretary of State had for the voluntary closure of Greencore, which they were more than happy to facilitate. And we agreed what we were able to do from a point of view of there's quite a complex close down process that Greencore have to undertake, and obviously it's a site that still does require maintenance from a point of view of machinery and staffing from a security perspective. So Department for Health and Social Care agreed for skeleton staff to stay on the premises that were either new to Greencore because they were provided through an agency, or were part of either a furloughed group of staff who hadn't been on the site for the 14 days prior to the Secretary of State's directive, or who had already completed a period of self-isolation because they were a previous positive test or a contact of one of those positive tests. So there was a clear agreement with the Department of Health and Social Care for that close down process and security and maintenance to be maintained, but production ceased. Whilst production was ceased, a full deep clean of all of the premises was undertaken. Again, people will remember that there were no concerns about the environment from a point of view of contamination or transmission, but obviously Greencore wanted to make sure that they provided additional assurance where they could. So the deep clean was undertaken. The information on that was provided to Public Health England, to myself and NBC's environmental health officers. We were all satisfied with the approach that had been undertaken, and therefore a small production line restarted on Tuesday evening with, again, the staff that had been agreed through liaison with Department of Health and Social Care out of, as I said, that small group of excluded employees. So pleased to say that they're back up and running on a much obviously reduced level, and have an agreed phased reopening approach with the Department for Health and Social Care, utilising staff as they come out of their isolation periods.
Thank you very much, Lisa. I think it was worth reiterating that, because there's been some confusion in the press, particularly about what's been going on there. So it's very good to clarify that. We come on to, I'm looking around the room, there's no further questions. Item 13 is any other business. I don't think there is any as such. So we come to item 14, which is future meeting dates. We've got the 4th of, Lucy, yes, hi, sorry.
Sorry, apologies. I think it's probably worth us taking the opportunity. Unfortunately, our police colleagues have had to depart, but I think it's worth us taking the opportunity to just visit. I think a concern, obviously, we're coming up to the bank holiday, and there are a number of events that are taking place over the bank holiday, as there normally would be in August. I'm sure less than there would normally be, but certainly still a fair few across the county, and including in Northampton, which is the only current area of intervention, let's remember. So I just want to be clear, the police and Public Health England liaise on the risk assessment and the processes that are being undertaken for all of these events to be facilitated. And we obviously are supportive of all events happening if they are able to provide information about how those can be undertaken safely. So environmental health officers, trading standards, all sorts of people get involved in those conversations. And we meet on a regular basis to ascertain whether we have any concerns. Obviously, there's been a lot of conjecture about the use of COVID-19 legislation. We just need to be clear. The legislative frameworks that the police and public health are able to work from require evidence that an event that's planned poses a health risk, a significant health risk actually, is the legislative terminology, to local residents. Now, obviously, if I'm ever presented with that information, then I would obviously take that very seriously, and on production of robust and clear evidence of the fact that an event poses a significant risk to the health of the population in relation to COVID, no other obviously infections, because this is specific legislation to COVID, then we would step in to obviously serve prohibition of orders and or to stop the event altogether. But the requirement to provide evidence to utilise that legislation means that we are never in a space where you can preemptively stop an event going ahead. So I just wanted to make sure that obviously people are assured that we have got a large team who are looking at and supporting wherever possible the events that are planned for this weekend and for the future. But obviously we are only ever able to utilise legislation where we have got evidence to say that an event poses a significant risk to the local population's health. So I think the police and I were keen to make sure that people understood the position in the legislative framework through which we're having to work at the moment. I know people had expressed some concerns over particular events happening this weekend. And obviously my team, police, environmental health, all sorts of other agencies continue to be involved in making sure that all of the events that are planned for this weekend happen as safely as possible.
Thank you, Lucy. You make a very good point there, because the inevitable question will be, well, where's the enforcement? And you've just demonstrated that it's not as straightforward as everyone thinks it might be. But there are moves afoot that can, things can happen if they need to happen. So that's very good that we've reaffirmed that information. So I'll come back to item number 14 then, which is the future meeting dates. Unless anyone's got any further business, I'll just double check. No, okay. So the next meeting is the 4th of September at 9 a.m. And then the next one after that is the 10th of September at 9 a.m. And then the 18th of September at 9 a.m. Can I thank everyone for their attendance today, both at the private part of the meeting and the public part of the meeting. And I wish everyone to have a good day. Stay safe and follow the guidance. And together we can all beat this disease. Thank you very much, everyone. Goodbye.
Thank you.
Thank you.